I'm very pleased to say that the investigation lead, Baroness Amos, is here. Thank you so much for being with us. It's great to have you here.
And thank you for all the campaigning that you've been doing on this subject.
Yeah, we feel strongly about it on this programme, I think it's fair to say. How would you kind of summarise your interim report?
Well, I think I would summarise it by saying that all the things that families have been telling us, I mean, over 400 families we've spoken to so far, have been borne out by the visits that we've done, the staff that we have spoken to, the leaders that we have spoken to. But I think the very important thing for me with this investigation is that we've been asked to take a system-wide view. There are many families that are looking for accountability and for justice, and I completely understand that. They've been harmed, they've been traumatised, they have lost their babies. What we are trying to do is to look as deep as we can, as wide as we can, and come up with some recommendations that will make immediate change when we make our recommendations, when we do the final report in June.
Yeah, that makes a lot of sense, because what can physically be done, what can tangibly be done? I feel like with maternity, we know it's bad. It's like, what are the specific things that can change?
And families say to me time and time again, we've talked about this before, we've told our experiences before, and I know it's very hard, and I've been so grateful to every single woman and family and supporter that's been prepared to talk to us.
One thing that's jumped out to me was the fact that you said that the NHS is incentivised to record deaths as stillborn because coroners can't legally investigate. I just want to read a bit of it to give the full context. Some parents were tormented by the thought that they'd seen signs of life, but staff had not recognised it. They felt the system incentivised the recording of deaths as stillbirths, as this prevents the case from being investigated by a coroner. I find this deeply shocking. Do you think this could be happening deliberately?
So, when investigations go wrong, and this is one of the big problems, you know, local investigations don't go deep enough, families feel that they're not engaged, they're not told. Many families feel that the only recourse that they have is to push for a coroner's inquest. But the law is very clear that a baby has had to have taken a breath. Now, who determines that? There are families who feel very strongly that they have seen a sign of life, and yet they are told that there has been no sign of life. And the very strong feeling from families is if they have felt a sign of life but they have been told that there has not, this is because a trust does not want to go through having a coroner's inquest.
Do you think that law should change?
We are looking at this in a lot of detail. I am not sure that as an investigation team we are qualified to be able to make that as a recommendation, but we've talked to a lot of families. This is a deliberate strand of work that we are doing because so many families raised it as a problem.
It's interesting as well.
Can I just say, it's just too soon to say what the recommendations will be, but we are looking at what kinds of recommendations we might be able to make in this area.
It's interesting because if you look at some politicians who's come forward, like Tim Loughton, for example, saying that Section 4 of the Civil Partnerships, Marriage and Death Act actually allows coroners to have this power. It became law, but it's not enacted by the government. So it feels like this is something, if they wish to do, they could do quite quickly.
I think there are a number of things in the report. It's not just in relation to coroners and inquests. And this is an area where there was a big investigation in 2019 that we may be able to say, you know, some of these recommendations should be implemented. But there are also other areas in our report where I feel very strongly that there are guidelines and practices out there that should be being implemented.
What kind of ones would you like to give any examples?
And are not. So there is a huge commitment to personalised care, for example, across the NHS. And yet, in so many cases, we are not seeing this happen in relation to maternity and neonatal health. That's just one small example.
Can I ask you about racism in the NHS? The stats speak for themselves. Black babies twice as likely to be stillborn. You say in the report that Asian women are sometimes seen as princesses who are making a fuss about nothing. Black women seen as tough, they can tolerate pain. Do you think that there is, I guess, kind of systematic racism?
Oh, undoubtedly. Undoubtedly there's systematic racism, which then is experienced through individual behaviours. It is part of culture and leadership. And I have to say that I and members of the team were quite shocked, actually, at some of what we were told, some of what we heard. And this has, a spotlight has been shone on this before, but the kind of systemic change that we need to deal with this is something that I think is still lacking. I think that there is a sense in some places that we don't know how to talk about this. We don't know how to put it out there as a real challenge. To actually hear some staff talk about, well, what do you expect in terms of poorer outcomes and poorer experiences because of the nature of the community that they're working with is really, really very difficult. To hear Black women make choices, they deliberately make choices that they know may put them in harm's way because of the experiences that they have had in hospitals before. So
like
even though...
What kind of thing do you mean?
Well, so a woman may have some pre-existing conditions that mean that actually it would be safer for her to be in a hospital, but she will choose a home birth because of the experience that she has had, the racist experiences that she has had in a hospital previously. This should not be happening. This is 2026. We should have a situation where, women and families are able to make the choices that are right for them. And if things go wrong, to understand that those choices it may not be possible to deliver in that moment.
Just finally, would you describe this country as a safe place for a Black woman to give birth?
That's a very difficult question to answer because, yes, in some places it absolutely is, in some others it is not. But it's also a difficult question to answer because it's so patchy. Sophie, it can be patchy in the same trust. It's very inconsistent. We are a wealthy country. We have lots of technological developments, but at the same time, there are things happening that should not be happening. So, of course, it's safe. There are many instances of safe, good practice out there, but when it goes wrong, it goes spectacularly wrong, and it should not be happening.
Thank you so much. I have to say, whenever I've covered the story, and we've covered it a lot on this programme, I've been kind of overwhelmed by the number of women getting in touch, and it is heartbreaking and difficult to hear, and frustrating that you can't do more about it. And I'm sure that's something that you've experienced yourself, listening to these stories. It's I can tell, just by speaking to you. So thank you very much as well for coming on the programme and talking about it.
But thank you.
Thank you.